Now, fluid electrolytes will be very useful in each patient. So if a patient comes in with no fluid electrolyte problems, guess what? They will develop one during admission. Okay. It's very interrelated to most concepts. So first we'll look at the fundamental basic concepts, and then we'll use exemplars. Exemplars is just a fancy word for example. So if you go to your learning modules under module 1, so we have for fluid electrolytes, we will have only two problems. Either the patient has a fluid deficit problem or a fluid overload problems. Then we'll apply them clinically to examples, for exemplars. For fluid overload, we will use heart failure as an example. Next example would be chronic kidney disease and certain stages of acute kidney injury at the same time. Now, for fluid deficit, we'll use for this semester, we'll use diabetes insipidus and also a certain stage in acute kidney injury. Okay, so we'll explain more on that shortly, but let's first begin with the fundamental concepts. Why we do this is because regardless of the exemplar, if the disease condition involves a fluid and electrolyte problem, the assessment interventions are really the same. I repeat, regardless of the example we'll be using, the signs and symptoms and the interventions will be the same. Are we clear? All right. So it doesn't change. I don't know if you've studied the textbook this way, but for every semester, like for instance, next semester, we will use the same concepts. So these are nothing new. You've learned these in fundamentals of nursing. Now we're just using clinical application now. Meaning, how do you use your knowledge of fluid and electrolyte imbalances to assess and treat your patients? Okay? Any questions so far? All right, so again, this is nothing new. So I'll review first what happened in fundamentals of nursing. For an organism made up of 80% water, is water important in a human body? Yes. Okay. There are two main compartments, right? What are the two main compartments of the fluid compartments of the body? It's either inside the cell or it's outside. Now, in terms of outside, there are two subcompartments. If it's not in the cell, then it must be inside the blood vessel. What are the blood vessels that we have? We have the lymphatic system, we have the venous system, and then we have the arterial system. Okay. What's the other compartment? The other extracellular compartment. It's in between cells and blood vessels. So again, we have three fluid compartments. Fluids, majority are inside the cell. Others are outside. When we say outside, there are two subcompartments. If it's not in the cell, it must be in one of the blood vessels. It could be also in between, not in the blood vessel, not inside cells. They're in the interstitial spaces. Is that clear so far? All right. Now, because there are three fluid compartments, water does not stay in one compartment all the time. It will continue to move. Right now, as you sit, and then a few minutes later and hours later, that water will continue to move. They will move between compartments. So let's look at first what causes them to move. Why does water move from one compartment to another? Okay. So we'll look at all the factors that influence it. Okay, what the passive and active water movements. Okay, our water moves by active and passive mechanisms. Most of them are passive. When we say passive, it doesn't ask your permission. It will happen whether you like it or not. Water will move. Okay, so our knowledge here on fluid movement will influence our knowledge on how to apply, what do we need to do for the patient if this is the scenario. Okay, so let's look at first the distribution. So we already discussed intracellular or extracellular. Anthony, can you read it this far? Yes. Okay. So we already discussed it's either inside the blood vessel or outside interstitial. And these are the distribution. These are not testable. Okay, I'm not testing you. We're done with the knowledge part. This is now all application. Okay. So look at how much fluid you have in your blood vessels. So at any given time, you have anywhere between 3 to 6 liters of blood in your body. That, of course, is influenced by your body size and also your age. All right, here's a visual representation of where your fluid compartments are found. So about 28 liters inside your cells, outside, which is in your bloodstream, up to 10 liters. Okay. Electrolytes, we will discuss separately. It's a separate section. Okay, let's discuss this concept here. What's the difference between osmosis, osmolality, and osmolarity? They actually refer to the same thing. Osmosis refers to the concentration. Osmolality refers to the concentration of a solution. What determines whether a solution is concentrated or less concentrated or more concentrated than another? What really determines it? Let's say water, tap water, or coffee. Which one is more concentrated? What made you say that? There's more coffee in it? What's in coffee? Why do you call it coffee? When you say caffeine, so I buy caffeine. So it's in what's in a coffee cup? So, okay, so what do we call those? What comprises a solution?
Electrolytes.
So a solution, a container. So who has a container of anything here? Okay, what's in that container? What's in this? There's water here, right? Yeah, this is basically water. But what did we add that changed it? This is matcha? Okay. So what did we add into this? Is there sugar in here? Okay, so what do you call the sugar, the whatever else is in here? Yeah, all the voodoo stuff that they added here. Or the sorcery. What is this in here? What do you call those? So you have the solvent and then the solutes. Okay, so you have the solutes and the solvent. Okay, so that determines the osmolarity or the concentration of a solution. Are you following so far? All right. So body compartments. So intracellular, extracellular, interstitial. Are they the same concentration? They always change. Okay. So it depends on when was the last time you took a drink of water. Okay. So therefore, if you don't drink water, let's say you're not given an IV solution, none of us here are receiving IV fluids. Okay. So therefore, depending on how much you had for lunch or when you had your last meal or your last drink, that determines the osmolarity of each of your fluid compartments. So therefore, it makes water move. Water must move. Why must water move? Why can't it just stay in one compartment? What do we call that concept again? This is just a review. We're not using anything new concepts here. What do we call that? Why does it move? What is the body trying to achieve? What's that word? Homeostasis. What is homeostasis then? All fluid compartment must remain equal. The concentrations must be equal.
Can y'all hear me? What about?
All right.
Put this around your neck, because if you move too much, it's fine. But I'll get you another one just for today, okay? I went downstairs and got a revelation.
You know, doesn't really help because it's wired. Yeah. Okay. Is it better? Would have been better if it was wireless, yeah? All right. So what is osmosis? Okay, osmosis, okay, according to the definition, osmosis is a mechanism. It's a passive mechanism wherein water must move. Water will move from what area to another area? From an area of lower concentration to an area of higher concentration. Now, why is that necessary? Because what are we trying to achieve again? Homeostasis, which is all fluid compartments must remain equal. The concentration, not the amount, not the volume, but the concentration must remain the same. Intracellularly, extracellularly, it must be equal. Okay, the concentration, the fluid concentration must be equal. To achieve that, this is the majority of the fluid movement moves via osmosis. Okay, can knowledge move by osmosis? No, someone with less knowledge just goes in proximity, goes to another classmate. Oh, this classmate has higher knowledge, I'll move. So does knowledge move by osmosis? It would have been great if that works that way, right? But it doesn't. Okay. So osmosis again is the movement of water, only water, from an area of lesser to higher concentration. So what happens when it does that? Did the volume change? Yes, the volume changed. So what will happen to the, let's say, the left, let me see if there's an illustration. Please watch this video. There's a video here, animation on explaining osmosis. But yeah, that's why I encourage you to go to the point, and it has something to do with the internet. Anyway, here, figure. Okay, so here's osmosis illustration. Figure 10-2. So as you can see, if the concentration of one compartment changes, meaning it increases in concentration, in order to achieve homeostasis, water will move. Again, it will not ask you permission. It will automatically move. So this is the concept we use when we choose what type of IV fluid does the patient need. This is how doctors decide what fluid to give a certain patient. Now, the fluid will the patient therefore receive the same IV fluid throughout the admission? No, because the fluid composition and the concentration also changes every day, sometimes every hour. So therefore, we will need to adjust based on the patient's need. Okay. Any question on osmosis? We'll get to the application shortly. Osmolality is again the concentration. This is referring to the pressure now. Now, if a solution has more solutes, meaning more concentrated than another, so therefore what happens to the osmotic pressure of that solution? Osmotic pressure is the concentration, the power. Okay, so think of it as a tug of war. If you imagine this figure, who will win the tug of war? So imagine those circles, those molecules as people. You know how to play tug of war, right? So who will win? Of course, the compartment that has more solutes, okay? So who will win the tug of war of pulling water? The compartment that has more solutes, the more concentrated, or the compartment that has a higher osmolarity. Any question? Okay. For exam 1, we will not do all the electrolytes so that it stays fresh in your memory. So for exam 1, we will only test sodium and potassium, because this is what will be relevant for the examples that we will be using. The example, the disease conditions that we will discuss over the next 3 weeks. So we'll start with sodium and potassium first, then later, when we get to cardiac problems, we will include metabolic problems as well. When we get to thyroid and parathyroid disorders, we will include calcium and then magnesium for cardiac as well. Okay, so for exam 1, we will concentrate on which two again? Sodium and potassium imbalances. Okay. Oncotic pressure, same concept as osmotic pressure. Okay, it's really referring to the concentration of a solution. It's pulling power. So you've seen the figure. So if I give you a hypertonic solution, for instance, if I start an IV and then connect IV tubing to you, start infusing an hypertonic solution, according to osmosis, water will move from where to where? So where did I put the IV solution? Into your intracellular or extracellular? No, when I gave it to you. Okay, where did I infuse the IV solution? Into your cell or into your veins? Into your veins. So is that an intracellular or extracellular? That's extracellular. Okay. So now I'm infusing a hypertonic solution. What makes it hypertonic again? Because it has more solutes compared to, well, there has to be a comparison, right? Okay, so I forgot that part. So what makes a solution isotonic, hypotonic, and hypertonic? The basis of comparison is always plasma. Let's go back here to the distribution. So here is plasma. Plasma is what? What do we mean by when we say plasma? Where is plasma in my body? In the bloodstream. So which part of the blood? So I slit my throat, blood comes out. Which part of it is plasma? Which part is plasma? So if I have a bag of blood, which part of it is plasma? Miss Bagley? So which part is plasma? The cells or the solution? Well, the cells are not really, it's not really a solution. Cells are molecules. So which part is therefore, are the cells the solutes or is that the solvent? So which is the red blood cells, white blood cells, platelets? What are they? Are they the solutes in the blood or are they the solvent? They're the solutes, okay? They are the suspended particles in the blood. So therefore that makes which part as the solvent? The plasma, okay? You can't tell unless you spin a blood sample. Does everybody know what a centrifuge is?
Yes.
Okay. Okay, so this is a centrifuge machine. So what is it for? Used to separate the cells from the plasma. So you put blood samples in it, you put specimen containers in it, and then you spin it. By a centrifugal force, it will separate the cells from the liquid. Okay, so when we separate that, now you'll see the specimen, the tube of blood will now have two parts, a yellow section and a red section. A red section are the red blood cells. Those are all the cells. They're colored red because that's the color of red blood cells. That's why it turns red. And then the yellow part is now what we call plasma. All right, everybody follow? All right, so let's go back here. All right. So the basis for the concentration of an IV solution is plasma. So the closest one to it that has the same concentration is 0.9% sodium chloride. Another example is lactated ringers. So if you have time, when next time you go to clinical, you see IV bags, please grab an IV solution, okay, an IV bag, and then look at the contents. Okay, so the bag label will say what's in it. So read one for LR and read one for NaCl, 0.9% sodium chloride. Okay, and then come back next week to lecture and then share it with me. What's in it? All right. Or if you forget, then you can Google what's in it and then tell me. All right. So let's go back here. So the osmolality of an IV solution is based on the suspended particles. What's in it? How concentrated is it? So therefore, if you, let's say you put dextrose molecules in there. What is dextrose? Sugar. That's sugar. So let's say you put 5% dextrose. That means if 1 liter bag of 0.9% now contains dextrose, 5% dextrose, what made it become 5% dextrose? What did they put in it? 5:1,000 parts of dextrose. Therefore, it became 5% dextrose. Does that make sense? Okay, so when I added sugar molecules in there, is it still isotonic? Since 0.9% sodium chloride is isotonic, but I added 5% dextrose in it, is it still isotonic? Is it still the same concentration as plasma? Not anymore. It became more higher osmotic pressure, higher osmolarity. Okay, so that's what it means by the osmolarity of a solution. So since now it's more concentrated, so when I infuse this into your veins, what will it cause? Because osmosis will do what? So I added a hypertonic solution into my vein, into somebody's vein. So where will water movement go now? From where to where? What is osmosis again? Movement of water from lower to higher concentration. Now, I'm receiving D5 normal saline. Okay, 5% dextrose in normal saline. So, when that's infusing into my bloodstream, what will it cause? Water will move from where to where? Again, what did osmosis say? Lower to higher. Okay, we got that part, right? Okay, so osmosis says water will move. It didn't say, it doesn't say water may move. It will move. Okay, water is forced to move from an area of what again? Lower to higher concentration. So again, I repeat, I'm receiving a hypertonic solution, such as 5% dextrose in normal saline. What will it do? It will pull water from, water will move from the cells into the bloodstream. Why? Because I changed the concentration of my plasma. I added 5% dextrose in it. So thinking about this, so what type of patient will benefit from a hypertonic solution such as 5% dextrose or 3% sodium chloride? Those are examples of hypertonic solutions. So what types of patient will benefit from a hypertonic solution? Those with edema, those with especially cerebral edema. So let's say you have some meningitis condition, or let's say you're a head trauma patient, right? So if I give you a hypertonic solution, what will it do? It will pull water from not just the cells, but the interstitial spaces. So it will benefit someone with fluid, with edema, cerebral edema especially, okay? So that's how we use IV solutions. Follow so far? Okay, so we know what a hypertonic solution will do. Let's look at what a hypotonic solution will do. So same, another patient. So you are Benjamin. Okay, okay. Yeah, okay. So let's say Benjamin is the next patient. I'm infusing a hypotonic solution to Benjamin. Example is a 1/4% sodium chloride, 0.225 or 0.45%. Okay, that's half the concentration of normal saline, and 1/4%, of course, is a quarter the concentration of normal saline. So that's both are hypotonic solutions. So I gave it to Benjamin. Okay. What will happen to Benjamin? I'm giving him a hypotonic solution. Is Maggie? Okay, so the fluid, the water will now move from his bloodstream into the cells. So which patient will benefit from a hypotonic solution? Dehydrated patients, cellular dehydrated patients. Are we clear? All right. So finally, isotonic. We call them isotonic because they have the same concentration as plasma. So what will happen? If I give somebody an isotonic solution, where will that fluid go? It has the same concentration as plasma. So according to osmosis, where will water move? Nowhere. That solution will stay where? Right where I put it, which is in the bloodstream. Are we clear? So what is the effect, or who will benefit from an isotonic solution, IV solution? Someone with volume dehydration, okay, not cellular dehydration. So let's say someone who has bleeding, for instance, okay. Before we can give blood products, because it takes a while before we can get blood, what can I give instead in the meantime to raise blood pressure and raise blood volume? An isotonic solution. So I have either LR or 0.9% or salt or normal saline. Another isotonic solution is D5 water. Now it may sound hypertonic, but it's not, because it only sounds hypertonic in the bag. But what happens is when you infuse dextrose, 5% dextrose in water, is they're only forced to stay together in the bag. But when you infuse it, the dextrose and the water molecules separate, so leaving an isotonic solution. So dextrose will go straight into the cells, so they don't really stay in the bloodstream. Okay. Any question on the IV solutions? Alrighty. So let's go to the mechanisms of how do we regulate water in one or more compartments. So our body responds to certain factors, certain forces. So we know about osmosis. Next is hydrostatic pressure. What is it? Thank you for reading, Mr. Weiss. Or Anthony. What is hydrostatic pressure? It is the pressure exerted by fluid. Oh. Okay, so the second part is referring to osmotic pressure, meaning osmosis. The first one, hydrostatic pressure, is the pressure exerted by fluid. Now, this is affected directly by the volume of fluid. So if I only have 1 liter versus 1 ml, which one will have a higher hydrostatic pressure?
1 liter.
The 1 liter. Between the Hoover Dam and a swimming pool, which one has higher hydrostatic pressure? The Hoover Dam. Okay, so therefore it's affected directly by volume. So the higher the volume, then the higher the hydrostatic pressure. Hydrostatic pressure, so can this generate electricity therefore? Yes, we know about hydroelectric power, right? So same thing, same concept. Now, if fluid exerts pressure against the walls of a blood vessel, doesn't matter if it's an artery, a vein, or a lymphatic vessel, what will happen? If the hydrostatic pressure is so high, meaning this is a condition wherein I gave you, let's say I gave Jamie too much IV fluids. What happens to the hydrostatic pressure in her veins? Increases or decreases? It increases. So therefore, what will happen to water? Since this is the pressure exerted by fluids against the walls of a blood vessel, it will cause water to what? If the hydrostatic pressure is so high, yeah, it will distend, but then will it extend? Will it distend indefinitely? Meaning, can my carotid arteries get this big, like this wide? No, it only has a certain limit. But then if the pressure doesn't stop, the hydrostatic pressure continues, what will happen?
Rupture?
Not necessarily rupture. It will. The hydrostatic pressure. We're not talking about blood pressure, okay? We're talking about hydrostatic pressure. Pressure exerted by increased volume of fluid. What will happen? Are blood vessels, by the way, permeable or not? The walls of a blood vessel, are they permeable?
Yeah.
Are they wholly permeable or semi-permeable? Semi-permeable. When we say semi-permeable, what makes it semi? Meaning,
It allows certain.
okay, so what is the determination? So how will the blood vessel determine, okay, you can come out, you can't come out. So what's the basis? The size of the molecules, correct? Okay, so are water molecules large or small? These are small molecules. So can they leak out of a blood vessel, out of a capillary, an artery, a vein, or a lymph vessel? Yes. So again, if hydrostatic pressure increases, such as when I put too much IV solutions in Jamie, or let's say somebody has really poor circulation and they're sitting all the time, okay, 24/7, they're in a chair, they're in a recliner. Or let's say you're on a plane ride, okay, 18 hours overseas. You're sitting in one spot. You're not getting up because you're using a urinal, for instance. Okay? I don't know how you do that, but you're using a urinal. Okay? You chose to use a urinal and then just dumping it into the carpet in first class, right? They let you do anything in first class, right? Yeah, you can pee. You can pee in the first class. Don't believe me? Try it. So what happens? What will form in your legs? There will be edema. That's from hydrostatic pressure, meaning from congestion. When there's congestion, there will be edema formation, okay, from sheer hydrostatic pressure. So here's the differences on your fluids. Now we have colloid solutions. Colloid solutions we're referring to mostly blood products, especially including albumin. Albumin is basically the main component of plasma. Plasma is about 70% water and it's about 25% albumin or protein, which is a colloid solution. Are they hypertonic, isotonic, or hypotonic? A colloid solution, like blood, plasma. No, colloids. Yeah, plasma, blood, are they iso, hypo, or hypertonic? Technically, they are the solution itself compared to your plasma. It is actually hypertonic. They're hypertonic, right? They are technically. Tonicity, again, this is the same concept as osmosis. Okay, tonicity is referring to the concentration. How much suspended particles you have there. So here we are again, we already discussed it. So isotonic solutions, where will this go? If I infuse isotonic solutions, where will this go? No, isotonic. Where will this fluid go? It will stay in the bloodstream. Hypotonic solutions, where will they go? Yeah, everything goes into the blood vessel. Okay, so we gave an isotonic, a hypotonic, and a hypertonic solution into the bloodstream. That's how we administer them. But where will they go? Okay, so isotonic, they will stay in the bloodstream. Here, it says here, isotonic solutions do not provoke water movement between ICF or ECF. They will stay in the bloodstream, right? Stay in the same place where you put them. Hypotonic solution, where will this go? They will move from the blood vessel into the cells. Okay, so remember, ECF is the blood vessel. Okay, blood vessel. ICF, of course, the cells. And then hypertonic solutions, where will they go? Okay, from the, no, not this one. Right here. They will pull water from the ICF from inside the cells into the bloodstream. Okay, so any question? Okay, so if you forgot, okay, just refer back to the paragraphs, okay, for your examples. So you said earlier here, example, we use cerebral edema, for instance, okay, very useful, hypertonic solutions. Well, mannitol technically is not a IV solution, but we'll discuss mannitol later under stroke next semester. All right, osmotic diuresis, last concept, and then we'll move on. What is osmotic diuresis? What is osmosis again? Movement of water from an area of lower to higher concentration. Okay, so that's osmosis. What is diuresis? Diuresis is when we no, yeah, what did you say?
Maturation, too much urine.
Too much urination. Okay, so that's diuresis. Now, from the word diuretic, we give a diuretic to promote urine output, right? Okay, so diuresis is excessive urine output. Here, increase in urine output. Okay, so what is therefore osmotic diuresis? Increased urine output caused by, okay. Why did this happen? Because what happened to the osmotic pressure of the bloodstream? It increases. For example, if your patient's blood sugar is high, what happens to the osmolarity of your blood? Say your blood sugar is 250, 300, 600, 1000. What happens to the osmotic pressure or osmolarity of your blood?
More concentrated.
It's going to be very concentrated. Okay, and then the same effect would be mannitol. Remember mannitol, as mentioned here? Mannitol is a osmotic diuretic. No, sorry. Yeah. This is an osmotic diuretic. Okay, will pull water, reduces cerebral edema in stroke patients or head injury patients. So therefore, osmotic diuresis is a increase in urine output caused by increased osmotic pressure. Again, a very good example here is in hyperglycemia. What are the three symptoms, the 3 P's of hyperglycemia? Remember now? So why did the patient with high blood sugar increase urine output? Because of osmotic diuresis. Why did that happen? The sugar is so high, so therefore, what happens to the osmolarity of the blood? Increases, and because what did osmosis say? Osmosis will cause it, says that water will move from. So therefore, water will move from where to where? From the cells into the bloodstream. So what happens to blood volume? It increases with hyperglycemia. And then what will the kidneys do? If there's so much water in the bloodstream, the kidneys will start making a lot of urine. Okay, So what will therefore a hyperglycemic patient die from? Did they die from hyperglycemia? Or did they die from dehydration? They will die from dehydration. Right, so that's it for passive fluid movement. And the last passive fluid movement is diffusion. So diffusion is not water movement though. This is now solutes. Okay, so this is still passive, but this is just like when you're making coffee. So if I make coffee, what did I put in the coffee maker? What are the two ingredients? Water and coffee maker. What did you put there? Water and the coffee, ground coffee, right? In the filter. Okay, so therefore, and then when it came out, what did it look like coffee? What happened? There was filtration. So unlike osmosis, wherein water moves from an area of lower concentration to an area of greater concentration, this one is the movement of solutes or substances from what area to what area? From an area of higher concentration to an area of lower concentration. And as if you read the rest of this paragraph, what's the clinical application here? Diffusion of gases. So this is how gas exchange happens. So when you inhale, what is the higher concentration at your lungs, at your air spaces? Oxygen or CO2? No, when I take a breath. Okay, so right now I'm taking a breath. How much, what is the higher concentration of gases in my air sacs, in my lungs? What is higher, CO2 or O2? O2 is higher. So therefore, diffusion says substances or molecules will move from a higher concentration to a lower concentration. So in which artery are we talking about here? The pulmonary, which blood vessel, sorry. Pulmonary arteries or pulmonary veins? When I inhale, artery first. So in the pulmonary artery, what is the concentration of oxygen there? High or low? Pulmonary arteries have high oxygen? Yeah? Why? Because it's an artery? Don't forget your ANP. So ANP, what is inside the pulmonary arteries? Oxygenated or deoxygenated blood? Oxygenated or deoxygenated blood? It's deoxygenated blood because where did the pulmonary arteries come from? From the right or the left ventricle? Come on, guys. This is ANP. This is fourth semester already. We have problems with your ANP. We won't go forward. Where is the pulmonary artery coming from? The right or the left ventricle? Right or left? The right side. The right side contains oxygenated or deoxygenated blood? Deoxygenated blood. So when I take a deep breath, which one's higher at the alveolar level? In my alveoli, oxygen or CO2? Oxygen, because I just took a breath. Higher oxygen. So what will happen? According to diffusion, molecules will move from an area of higher to lower. So therefore, the oxygen in my alveoli will go into the pulmonary arteries, into the pulmonary capillaries. But the pulmonary arteries, what is higher there? CO2 or oxygen? CO2 is higher. According to diffusion, what will happen? CO2 will move from an area of higher concentration to an area of lesser. So does that make gas exchange possible? Yes, so that's a perfect example of diffusion. Any question on diffusion? All righty. Sodium potassium pump, we'll discuss this when we go to MI. This is really the best example there, MI, I know a heart attack next semester. But this requires power though. Sodium potassium pump, this requires ATP. What is the source of energy in the body? ATP, right? Okay, that's what keeps us alive. We make ATP. How do we make ATP? What are the two ingredients to make adenosine triphosphate? And oxygen and what are the two ingredients? Two basic things a human person needs to survive: oxygen and glucose. Okay, so you have oxygen molecules, you have glucose molecules, then you have ATP. Okay, so that's the sodium potassium pump. Okay, so who remembers sodium potassium pump? How is this made possible? Yeah, it requires power. So how is this possible? When sodium, which one is where? So sodium is found where and potassium is found where? Which one's in the ICF? Potassium or sodium? Potassium's in the ICF. What about sodium? ECF. Okay, so I'm not saying they're only found exclusively there, meaning I should rephrase the question. Where do you find more of potassium? ICF or ECF? ICF. Okay, and then where do you find sodium more of? ECF. Okay, so in order to make the exchange, it requires power. Okay, it requires energy in order to open the channels on the cells, on the cellular wall, either in the cellular wall and also on the walls of the capillaries. You need to open and close them. And how do we make them open and close? With ATP, with energy, with power. Like I said, we will discuss this. This will make more sense when we get to heart attacks. All right, so let's conclude this part and then we'll take a break. So here is your intake and output. Now, this is not always the same. It will differ, of course. How many people here really drink 8 glasses of water? Okay, very good. Okay, very good. I don't. I know I don't. Okay, I'm still alive though. Right, so that it affects the actual number, but averages, this is about the same. Do we only get water from the food we eat, from water we drink? No, it can come from any beverage. It can also come from food. Say I ate more fruits, that's still water, right? Okay. But the intake and output is about the same. So your INO should be 0. However, in clinical, it won't be like that because are all output measurable and are all intake measurable? No, like I said, food, even hay. Who eats hay here? Have you ever eaten hay? You want to? Trust me, hay has water, okay? How do you think cows and goats survive? Okay, there's water in hay. Okay, no matter how dry it looks, there's actually water in it. And insensible fluid loss, the fluid loss the fluids we lose from talking, like right now I'm talking, I'm losing a lot of water from vapor, right? Water vapor from exhaling every time I talk, and also through sweat and also through feces, right? I had 3 bowel movements today, right? So how much water did I lose? Can I measure that? Do I squeeze all my feces and then measure? Okay, I want to make sure I have adequate output. Okay, so I grab a handful and then squeeze it, okay, and then separate it. Is that how I do it? No, we estimate the insensible fluid losses. So looking at it here, so if I pee about 1,500 insensible fluid loss from these, look at this, from my lungs, skin, and feces, that's about 1,000, right? Doctors usually average it around between 600 to 900. That's just an estimate. So this works perfectly in Have you heard of people who have end-stage kidney disease? Those people who are on dialysis? Yes? Okay, so those people do not pee anymore. Right? So we have to incorporate, especially for those patients, the insensible fluid loss. Okay, we'll discuss that more when we get to AKI and ESKD, which is probably next week. Okay, so kidneys excrete majority of our fluid loss through the urine, skin a certain percentage depending on the season or the weather. Lungs also, the more you talk or your physical activity as well. So the more you exercise like me, so I spend like 6 hours at the gym every day. So I lose a lot of water in my lungs, okay? I mean, through my lungs. GI tract also. The harder your feces, of course, the less water you lose there. All right, let's go to assessment findings now after the break. Take 15 minutes, come back at 2:28.